So our first speaker is somebody that I met on LinkedIn. Does everybody in here have LinkedIn? Yes? It's somebody that I met on LinkedIn. Were you somebody that I spammed? Okay, guys, we spam each other, right? But when you spam each other, right, and especially when you have the right motivations in mind, you end up having a connection like this. I think, Nikita, you're based in Georgia. All right, she's based in Georgia, but she's crossed state lines. You know, you get in extra trouble when you cross state lines, right? But she's crossed state lines to give us some education. Everybody, please give it up for Nikita Shilay.
Good evening, everyone. Again, my name is Nikita Shilay. I do health and life insurance. A few kind of questions I have before we dive into it, because I know there is absolutely nothing sexy about health insurance, but we are here tonight to discuss it. I really want to know, just from a raise of hands, how many of you feel confident that you fully understand your health benefits? Okay, one, that's impressive. A couple, again, super impressive. How many of you have ever been surprised by a medical bill? I would expect more hands. Okay, I understand, we're still warming up. What about who here has spent more than an hour on the phone with their insurance company? Pain in the ass. I can own it. I do it all day long. Now, I do want to open this up though, if anyone does want to share. If you could change one thing about your health insurance, what would it be? Okay, lower monthly costs. Anything else? Benefits? Okay, that's it. That's all we're going to change though. Okay, awesome. What would peace of mind around health insurance look like?
Well, you had to go to any hospital and see any doctor.
Okay, essentially nationwide, right? You're talking about a PPO, but making that more accessible. Yes.
And it actually covers you instead of 40 million exclusions when you actually get to the
Right.
Oh my God, absolutely. I mean, that's a huge obstacle that I feel like so many people run into. So again, I know there is absolutely, again, nothing sexy about health insurance. It's kind of like going to the dentist and getting a tooth pulled, talking about an X. But I will try to make it as stress-free, maybe a little bit fun, so we can kind of dive into it. Okay. One of the biggest things, kind of before I start, is I do want to thank you guys all for coming, showing up. I want to thank Randolph, again, putting on this event. So incredibly lucky and appreciative to be here with you guys. So one of the things I'm going to dive into, just to kind of start, is I want to talk about the marketplace changes for 2026. And there are some huge updates if you guys have heard anything, okay? Skyrocketing costs, carriers pulling out, marketplace changes. I'm going to dive into that, okay? Just so you kind of understand what we're working with for the upcoming calendar year. I want to dive into what it looks like from an individual and family standpoint, as well as what essentially small business options are going to look like, right? Because we do have a lot of small business owners and operators here, whether that can help not only yourself, but right, I don't know if we have financial advisors in the room, plans, I'm sorry in advance, we're already coming at you. But I want to just kind of dive into all of that together with you guys today. Okay. One of the biggest things with health insurance, kind of why it matters at the start, is essentially for a lot of small business owners, health insurance premiums are actually the second or third largest expense that they are covering from a monthly standpoint. Okay, so right off the bat, health insurance is up there from a cost standpoint. It is not just a benefit though, it is also a financial tool. Okay, there's a lot of tax saving benefits that we can dive into, and we will, in order to keep that money in your pocket. If you are stuck paying for health insurance, you might as well maximize it, okay? So one of the biggest things, again, we're going to talk about marketplace changes, small group plans, and then we're really going to dive into these three core pillars. Okay, so tax strategy, we're going to look at risk exposure, as well as retention power. So if you're offering it to an employee or to a small group, what that looks like, kind of dive into some of those statistics. Okay. So just kind of talking about open enrollment 2026, which is going to be your Affordable Care Act or your marketplace health insurance policies. Okay, I'm sure a handful of you guys have heard about raising rates. And I'm going to talk specifically about the nationwide scale. I don't know if any of you guys have businesses from a nationwide standpoint, as well as specifically Florida in particular, because they are going to be slightly different. Each state is state regulated when it comes to health insurance. Again, I know it can be incredibly boring. So essentially the way health insurance is structured is it's really a risk pool, okay? So the money that is coming in from a premium standpoint, again, it's a business at the end of the day. They are expecting to make a profit. When they're paying out claims, they are still hoping to make a profit. So that's how you hear about a lot of different carriers that are going bankrupt or pulling out. So essentially, again, we're looking at health insurance from a risk pool standpoint. Off the bat, we are looking at some pretty hefty premium hikes. Okay, on average, we're looking at around 10% to 60%. Okay, and again, I'll go into, I know, but there's options around that. But again, just want to give you the numbers. I don't want you guys to come into open enrollment and be completely shocked with what's happening. Now again, these are specifically going to be the Affordable Care Act or Health Sherpa. Okay, they are the same, marketed as the Obamacare. Again, just to kind of go through those public government options. Okay, trying to find it. Just to talk about Florida, I'll go through that afterwards. So kind of going into those premium hikes, Aetna is completely exiting Florida market. So if anyone has entered the government, you guys are probably going to get your letter in the next couple of days. Aetna is totally pulling out. Okay, they're pulling out nationwide from an individual standpoint. Small group plans, they're going to kind of continue. There's a new market coming in. It's called Community Care Network. They're in select counties and zip code specific. But again, you guys are going to have about 16 different carriers through the Affordable Care Act for 2026. As well as Cigna is expanding, but they're only expanding their HMO policies for 2026. Okay? You guys, I'm going to pull the teeth really quick, talk about their specific rate increases, and we'll talk about how you guys can save money. Okay? If anyone has Molina in this room through the marketplace, no, that's cool. Molina's looking at before subsidies a 40% rate increase. Okay. Let's see. Blue Cross Blue Shield, on average a 29% rate increase. You guys should be getting your letters if you haven't already. Okay, again, there's options around this. I just want you guys to anticipate it. The letters are coming. I'm not looking to pull the teeth here. And then as well as AmeriHealth, I don't know if I'm pronouncing that correctly, they're looking at around a 37% rate increase. So prior to subsidies in 2026, in Florida, they are anticipating that 30% rate increase through the marketplace. Okay, so what is happening is the marketplace is essentially going to come back with their subsidy hikes, which is going to be 400% the federal poverty level. So essentially, if you are making more than 60, I believe it is 63, about 63%, you are no longer eligible to get a government subsidy. You are having to pay full price for your health insurance. Okay?
Yeah. Okay, on that. You know, you just said 60%, what percentage of the
So and I have a quick
poverty level?
I'll have really quick.
12,000 a year?
Yeah, we'll go back. So these are our current subsidy limits for the marketplace. For an individual household size, okay, 400% of the federal poverty level is 62,600. Okay, meaning if you make more than that on paper, you are not eligible for a government subsidy. Again, you guys, there's so many savings techniques and private plans we are going to look at. I just want you to know what the marketplace is going to be sharing with us. Okay. Again, household size of 2, 84,000, etc. For the longest time, individuals for the last couple of years were able to essentially ballpark their income. If you've ever done the Health Sherpa applications, and the government was not essentially fact checking. So there are going to be significantly tighter verifications. Essentially, you cannot just make up what your income is going to be on paper, because again, it's really frustrating, especially for a lot of small business owners. Look at your real estate professionals, right? Incredible years a few years ago, and the market slowed down. So I don't know if I'm going to sell 5 homes this month or 0 homes this month. So for someone who has that, let's say, more liquid income, the marketplace is going to be a much more difficult kind of solution, because you are having to speculate that income when you enroll in a plan. Well, enrollment is November 1st for a January 1 start. So I'm guessing what my income is going to be for all of 2026 in January, or even before January, right? So they are going to start asking for proof. Again, just to kind of walk you guys through it. Additionally, if you have not filed your taxes, you no longer are able to get a subsidy. They are going to become really strict on that. So if you have not filed 2024, no subsidy. And they're going to start to keep that line going forward. So if you don't file by April and you request an extension, they're going to yank that subsidy from you. So if I, let's say for my family, had a $1,000 premium and I was getting an $800 tax savings or a subsidy through the government, so I'm only paying $200, right? Everyone's following that math? And I choose not to file my taxes or I file an extension, I don't have to pay that full price. Is what they're doing. Okay? And then again, if you did qualify for a free plan, they have now tacked on an auto re-enrollment fee of $5. Okay, so again, if you have insurance through the marketplace and you're planning just to let it roll over, double check. Okay, talk to your broker, get a new broker, talk to someone who can help you make sure you are doing the right thing. Okay. So ultimately though, if your income fluctuates, you are self-employed, just plan early, and we're going to go through what you can do to keep that money in your pocket, as well as alternatives that you guys have the ability to take charge of your health insurance. You are not stuck paying those 30, 40, 50% hikes. Okay? It's absolutely insane. It is ridiculous across the board. So when the marketplace does make sense, okay, so if you are someone with major health issues, the marketplace is a great alternative for you. If you're an individual or a small family and you have major health issues, the marketplace is a phenomenal option because they cannot exclude off of health issues. Okay, so a lot of people that can go to the marketplace, God forbid, but with major health issues, again, they cannot deny you for your $4,000 prescription. They cannot deny you for, God forbid, an upcoming procedure. You can enroll, and again, there's no exclusions from a health standpoint. Okay. The other thing also is consider if your income is set, and it does plan on being under at 400% federal poverty level. It is something to consider. You do qualify for some pretty hefty subsidies, again, based on income. We'll talk about how to prepare for it. Okay. Now, private side. Okay, this is where a lot of my small businesses are going to go running towards. Whoops. Okay. Now, essentially, the way the small business plans work is they are going to be typically more so based on health. Okay, hence why, right, go to marketplace if you have health issues. Private plans, they essentially are looking at it from the same thing I said at the beginning, a risk pool. So if all of us were in a small group plan together, essentially what the insurance company is doing is they put us all into a bucket. They're using our social security number and they're taking a look at our claims and they're trying to figure out our base price. It's to keep it as simple as possible, okay? And if, let's say my front row, sorry you guys are stuck closest to me, they all have major health issues, they're gonna put a price tag on the front row first and then they're gonna clone it to everyone in the back. Okay, anyone familiar with kind of how like those group plans work? So what you can do instead as a small business owner, if you are looking at it more from an individual or family standpoint, there's a lot of private policies available you can enroll in that do keep the cost significantly lower. So like I know United Healthcare is a big one that does this, is they have a giant group plan in about 40 states with over 200,000 essentially individuals and families. So that risk pool, right, going back to the risk pool, is healthy enough to offset the cost. Okay. So as a small business owner, you do have the ability to write off your medical premium, actually at 100%. Okay. Now, if you're getting that subsidy I was talking about, you don't get to write off the $800 you're getting handed from the government. You get to write off what you're contributing out. But again, if you are going more for a classic or a small business group, you get the ability to control what you're adding. Okay. Now you can write off your dental, and you can write off your vision, and you can also write off some of those additional accident benefits that you're looking for, depending on what you do. Short-term disabilities, some long-term disabilities, some critical illness benefits. It actually is lumped into the medical, essentially medical portion of what you're getting. Okay, so you just have a lot more control over what benefits you're adding on, what you want, what you don't want. All of the men in the room, you guys can take off essentially on some policies. You don't have to have maternity coverage. It actually lowers the cost of your policy because you are not paying for maternity care. Most of you guys aren't going to use it anyway. Okay. As well as financial benefits. Again, you do have the ability to write off those tax deductions, and it essentially will lower that adjusted gross income. If you are stuck paying for your medical insurance anyway, whether you're set up as an LLC or an S Corp, we'll go into like the HRAs, the HSAs, much information and prepare for next year as I can. Okay? And then the flexibility and strategies, right? Those are gonna help you, again, if you are a small business, you're offering group policies across the board, you do have the ability to actually choose what you wanna contribute. So let's say I have 5 employees, okay? And clearly I'm the business owner, I get to write off my premium at 100%. You have the ability to control how much you wanna contribute to your employees. So if you are under 50 employees, you actually don't have to contribute anything towards their medical premium. You really don't. You can choose, I'm gonna offer them the group rate at the cost. So instead of them getting it by themselves for that $800 price point, they might get it at $500 through the group, and you can offer it to them without contributing towards that medical premium, but they're able to get the group rates. Okay, so they're part of the group, they think you're offering the benefits, which you are, you're just not contributing towards them. Okay? Or on the flip side, what you have the ability to do is, again, contribute, whether it be from a percentage standpoint, I'm gonna cover half of their premium, or like a fixed amount, $100, $200, you get the ability to choose. Okay? Quick comparison, again, just to kind of walk you guys through it. Marketplace, I noticed it is gonna be better for your individuals, families, major health issues. Your small group plans are gonna be better for self-employed, small business owners, or your healthy individuals. There are a lot of private options or small group plans you guys can look at. Again, you do get free tax benefits from the small group plan, more so post-tax benefits from the ACA marketplace, and they are going to be income-based, whereas the small group plans actually are going to be more on the health-based side when they structure this cost. Okay. So health insurance as essentially a building tool. So you guys can keep your costs down. Okay. So essentially, again, if you're offering that group rate, you get to determine your contribution. Okay, this is where the insurance starts to become a financial one. So it's no longer just about benefits, coverage options, etc. We're turning it into a financial one. So this is where the health insurance can be set up through the business the correct way. Okay, so I typically recommend using your banking. If you do have your own company banking account, set it up through it. You can set up your payroll. But this is where you can treat it as a tax deductible expense, meaning those dollars reduce your tax bill. Okay, so that way you owe less money at the end of the year when you are filing your taxes. Okay, 52% of employees essentially gravitate towards plans. They have a lower turnover rate if they are businesses or offering employees. There's a lot of employees out there gravitating towards policies specifically for health insurance benefits. Again, whether you, the business owner, is contributing or not, they are just looking for a company that offers benefits at the end of the day. So that way they can avoid those marketplace options. Okay. So when the ACA still makes sense, also kind of going into some of those tax strategies, there's a few different directions you can go. One is called an HRA. It stands for a health reimbursement account. Okay, essentially what that is it's designed more for a business owner, and it is saying, as a business owner, if I have a bill, I am quote unquote giving it to my company to refund me. Okay, it's a reimbursement. So it's not like the HSA, which is essentially a savings account, where every month you're putting money into a savings account, and it's designed for essentially those expenses, those medical bills. The HRA is, again, more of that reimbursement account, but you have a lot more control. Because an HSA is for a high deductible plan. So again, you're kind of putting yourself, while you're getting the tax benefits, you are having to take a step back and choose a policy that might have a higher deductible. So instead of having, let's say, a no deductible, $3,000 deductible, you have to have that high deductible to kind of pair with it. So again, one of those things that I'll talk about later on, but it's finding that right plan. It's not just finding the cheapest option, right? Because I might get the cheapest plan, but then might be subject to a $9,000 deductible or a $9,000 max out of pocket, and I'm not putting myself in the right position. If I'm someone who knows I have a surgery coming up, my cheapest premium is not going to protect me. It's not. There's a statistic I learned the other day, 66% of all bankruptcies is due to medical bills. Right? Isn't that crazy? Okay? And the other thing too, with a lot of plans we're going to talk about, some of those limited benefit or those short-term policies, they're not advertising that way. So I'm going to tell you the questions to ask your agent about your plan, about when you shop for a plan, just so that way you guys can not make those again, God forbid, mistakes and be unprotected at the end of the day. Other things you guys can look at is something called a QSC HRA. It's a qualified self-employed HRA as well as an individual HRA as well. Again, just some additional tax savings benefits that you guys can pair with your medical bills to lower those out-of-pocket costs. Each situation is just a little different. Okay? Three random scenarios. You guys, I get hit with these all the time. Again, each person, each case is going to be so drastically different when it comes to understanding their policy. Okay? So just a few different scenarios just so you guys might be able to see if any of these is your better fit or if you fit into one of these buckets. Scenario one. My solo owner with no employees. It's just them, they have their own LLC. Okay? Mom and pop shop, they're the only ones who handle it. ACA might be your cheaper option. Okay? If you are set up as essentially an S corp, you funnel that income, you have that set payroll expense going to you, that set income on paper. Again, depending on how you structure it, that's why we're getting ahead of it. ACA might be your option, okay? Especially if you're able to partner that with a subsidy and like an HSA or an HRA to keep that money in your pocket. Okay? If you have major health issues, right? If God forbid I know I'm on a $4,000 injection, or God forbid I'm pregnant. God forbid, that's not the right word. I'm not pregnant, and I was curious, but let's say I was pregnant. The standard delivery is $10,000, right? Just a standard delivery is 10 grand. You know, if I had a NICU child, they're looking at about $120,000. Okay? If you are not signed up for an insurance plan through open enrollment, you no longer have the ability to enroll middle of the year. Okay? So again, health issues, scenario A, go marketplace. Typically, especially if you're an individual or a small family. Scenario B, my self-employed small business with 5 to 10 employees. Private group plans typically are going to be the better option. Now there's two different ways to get group plans nowadays. Okay, the first puts everyone into my bucket. Right, risk pool, you guys, I'm going to keep going back here all night long. Puts all you guys into my bucket, and the insurance company structures the price of the plan. Okay. So what I'm able to do is I can put a group price across the board. Depending on the carrier, depending on the risk pool, that might be your better option. My second alternative for private insurance, I'm still in scenario B, is to look at each person individually. A small business group plan can be structured this way, where let's say I'm my business owner and I'm in my early 40s, and all of my employees are in their 20s, okay? Well, I know me at my 40s is going to increase the cost of them in their 20s. So something that you guys do have the option to do is there are some small group plans that can structure based on based on gender and age. So now I can get, again, I might be the oldest and most unhealthy in my group for $400, but maybe all my 20-year-olds are going to be $200 premiums, which is going to be much cheaper than, again, that lump price across the board. Okay. Scenario C, my owner with a higher income or unpredictable income, right? If I'm a real estate professional and I can swing from selling 5 homes one month and 0 homes the next, or if I have a huge project on the line, but it's, it might come once, twice a year, but it's a massive deal. Okay, again, just more of that unpredictable income. I notice the private plans tend to be more beneficial for them. Okay, again, without even talking numbers, just kind of talking directions and paths. Because again, each path, unfortunately, have anywhere from 10 to about 100 different directions they can take. Whether it be, a PPO, an HMO, deductibles, networks, prices, etc. Common mistakes. Some of the biggest things that
I'm just letting you know that we're out of time. But
I'm out of time. I will speak through the last.
Okay, go ahead.
I promise. Common mistakes. Check your lifetime maximums. If you guys take anything away from this PowerPoint, it's going to be these right here. Check the lifetime maximum of your plan. There are a lot of private policies that will cap at $500,000 in coverage. Okay? If you are unprotected and uninsured, you are no longer essentially getting that unlimited benefit. Get your insurance license agent ID. It's something called an NPN. It's our national producer number. Anyone who's in the insurance field, they have to have their license. Yeah.
On the ACA, just so you know, if you put in, let's just say you put in $63,000, at any given point, if you realize your income is going to go up or down, you can't contact the marketplace to put it in so that you won't be.
And and they'll give you a bit of a grace. I think it's like a $4,000 or $5,000 grace based on like zip code and area. But again, if it's like a $20,000 difference, you're going to get whacked when you file your taxes. They're going to make you pay that subsidy difference. But again, get that NPN, National Producer Number. You can look them up, make sure they are licensed and who
Yeah, I'm
they are.
licensed.
Huh?
I'm licensed.
Okay, so you understand,
I
right?
do have life and health.
Yes, so there you go. Yep. Get the NPN though, right? There's so many, I hate to say it, there's so many agents that are not protected, or going through a call center, and they're not putting their agents or their clients in the right direction. If you are going through the ACA, file those taxes sooner than later, so you don't get whacked with that ACA, essentially subsidy securing. Okay. Again, I know I'm tight on time. If you guys want to take pictures of the slide, you're welcome to. But essentially, get your doctors in line before, know their names. Have it ready when you talk to your agent on the phone, your doctors, your prescription list. Talk to your wife. A lot of times women are not telling their husbands about their OBGYN's name or the prescription they're taking, and then husbands will hop on the phone and have no clue what's going on with their wife or kids. So just have those conversations kind of beforehand and prior. Run what scenarios with your agent. Again, just make sure you are protected and going through those different scenarios. I know I'm tight on time. I think I only have one more. Essentially, be smart. Talk to someone you trust. And then again, talk to an agent, talk to someone you trust. A lot of people will just sign up for health insurance and they never revisit it until the end of the year. And if you have that wrong income on that paper, again, I've done it myself, is when I swapped over from an LLC to an S Corp, and I had to funnel that income into my pocket instead, and I had to pay a $4,000 tax penalty. I've done it for myself. I'm the first person to say that I messed up, and I'm in the insurance industry. It happens to my clients, just because again, a lot of people will sign up and they never think about it again. Cool, I know I'm out on time, so I tried to fly through the last little bit, but if you guys have questions, I'm absolutely here to answer.
Everybody give it up for Nikita.